already included in one way or another in the recommendations and the mandates that we've issued here in South Carolina. If our people, I think our people are capable of doing what is best for themselves, their families, and their neighbors, and if they will follow the rules that are made, that are suggested and required, those required here, that are based on science, data, the experts with experience and knowledge in these areas, and based on that and nothing else, as well as common sense. If they will do those things, then we don't need to have mandates like they may have in some other parts of the country.
Governor.
Yes, ma'am.
You've banned all large gatherings. Are there you've banned all large gatherings. At this point, are there any plans though to limit the number of people coming into certain businesses like grocery stores to just 30 or 50 people at a time?
We have nothing mandatory there, but all the rules about social distancing apply everywhere. Also, as you know, our grocery stores and a lot of the other businesses have provided for senior days, senior hours, to allow for the elderly population to come in when there's less traffic, less confusion, and more social distancing available. Again, most of the things that have been mentioned anywhere in the country have been addressed in one way or another by our experts right here in South Carolina, with a good dose of common sense and based on experience, and trusting in the integrity and the experiences of the people of South Carolina. We've been through hurricanes. We've learned how to work with each other over and over, and that is putting us in good stead in working with this war, as Senator Graham has described it, and Senator Scott. Are there more questions?
Dr. Bell, on first responder priority testing, we hear that there are now more than 4 sites around the state. Can you update us on the number of sites for first responders and where those are?
I'm not familiar with the testing sites. I'll ask Director Davidson.
Sure. You're exactly right. It has been a priority of us to ensure that we get first responders tested and tested quickly. We have, I believe this morning's report had 7 on it, and we were working on an 8th one for today as well. So we know that it has not been statewide coverage. We certainly encourage locals, if they have arrangements with their local hospitals and whatnot, to feel free to make those arrangements. But we also see it as our responsibility to make sure that there's a backbone to back that up. So it's growing every day, and that's our intent.
Governor McMaster, or to the senators, the president just ordered GM to make ventilators. Should the president do that for any South Carolina companies?
Well, Tim, the Defense Procurement Act is set up to transform the economy to meet the needs of a crisis, mostly war. But in this case, we're at war with an unseen enemy. It's called the virus. World War II, we stopped making cars and we started making tanks. We stopped making commercial airliners. We started making bombers and fighters. So what we need to do is get the ventilators supply chain up and running until the F-100 is a great truck, but you're not going to make any more of those till you make the ventilators. This is coming back in the fall. So what I want to do in the spring is to go ahead and ramp up the supply chain, make sure we have the masks and the ventilators and all the things that the frontline troops need to fight this virus. In the summer, hopefully the heat will slow it down, and by the fall, Dr. Bell, we'll have drug therapies that whack the hell out of this thing, and by the end of the year or the beginning of next year, a vaccine to kill it. So we're literally buying time. These containment policies are tough, but they're allowing us to buy time to get the drug therapies and the vaccines that will eventually destroy this virus. The supply chain medically needs to be told right now, do whatever you need to do and do it now, because it will come back in the fall.
I have a question.
There's no doubt that if you look at what the president has been able to successfully accomplish without mandating that companies get involved, he's been able to get companies to consistently volunteer getting involved. That's one of the reasons why Ford is already working on the process of creating ventilators, and GM is now, sounds like, coming into the fray. There has been a strong, positive, voluntary reaction to the president's request to have as much as possible the Marshall Plan in action.
If indeed the heat does slow this virus down, how would that play a part when it comes to social distancing later on in the summer and large gatherings? Would we resume back to normal life, or how would that play out?
Well, we'll continue to monitor disease occurrence, and we always try to make the most effective disease control measures with the least restrictive means. And so when we begin to see disease trends come down and we can resume other activities that pose a lower risk or a lower threat to the public health, we're continuing to work with decision makers about providing disease information and what to expect. And I want to follow up on an earlier question about the business closure. I just want to make the distinction between optional activities and essential activities, and to think about the types of activities that bring people into close contact. So there's a difference between canceling festivals and large gatherings and things like that, as opposed to the type of contact that we experience in a business setting. So there are different levels of risk. And we will continue to monitor disease trends and make decisions about what the most effective and least restrictive measures are when we come to that.
Senator Graham. Senator Graham. President Trump has given the goal to have the economy completely reopened by Easter. What are your thoughts on that goal at this point?
That's not what he said. President Trump said he wants to get as much of the economy reopened as soon as possible based on sound science. I trust Dr. Fauci, I trust Dr. Briggs, I trust Dr. Bell to tell the governor and the president, here's sound science. They're going to look at every county in the country. They're going to look at every region in the country. And we're going to make a sound science decision about opening up business. During the spring, I would be cautious. There will be a plan next week, I think, that will look at the country based on risk, high, medium, low. Some counties have very low risk. You would treat them differently than you would New York City. So the president, one, is going to make a decision based on science. It will be blessed by Dr. Fauci and Briggs, or I'm certain of that. And the governor is not going to be bound by these recommendations. The governor can do what the governor needs to do for South Carolina, and every governor has the ability to do what's necessary for their states. So I think I want to do two things. I want to contain the virus very aggressively, and hopefully the summer will blunt its spread. I've been told it will. We'll see. But the bottom line is, to create a bump in the economy, you don't want to create a spike in the illness. But all things are not the same. Dr. Fauci said you don't need to treat every place exactly the same. And that's exactly what the president's saying. I think that's what the governor's saying.
Governor McMaster.
Last question, please.
Governor McMaster, the state has a program that garnishes people's tax refunds.
I'm sorry, say what? Say it again.
The state has a program that garnishes people's tax refunds if they have unpaid debts. Will that program continue in light of this economic situation?
We have extended the time for filing and paying taxes to make it consistent with the federal. That's a question that I don't have the answer to on my tip of my tongue, but we will get that answer for you and for anyone else. Any more questions?
So, Dr. Bell, earlier this week, it was said that DHEC was unfamiliar with the loss of senses as an indicator for COVID-19. Representative Cunningham tested positive for COVID-19, and those were his only symptoms. So what is the thinking about those symptoms now, and should it be an indicator for people to get tested?
So we focus on the symptoms that are most highly correlated with the infection. So we focus on fever, shortness of breath, a cough, but we recognize that there can be other associated symptoms that are not as commonly as associated. Muscle aches, I've heard these reports of the loss of senses, smell and taste, but we don't have a large enough body of evidence to say that a symptom like that alone is an indication for testing. So we focus on what we know best about the disease to make decisions about when to test. And so what's most consistent is an influenza-like illness.
Should they at least stay home, though? I mean, is that enough of an indicator to self-quarantine?
I think that if anybody develops new symptoms that they're concerned about, they should consult with their health care provider and make a decision about if testing is indicated based on a personal basis.
Okay, y'all, thank you very much for coming. We appreciate our two senators being here as well today.
Good to be with you.
And until we come back, thank you.
And right now, if you're just joining us here at the top of the 5 o'clock hour, just to reiterate some of the highlights from the governor's news conference we just watched. He is not issuing a statewide stay-at-home order. So that's one fact that came out of this. It's not happening. But what he did say is he is issuing an executive order to anyone coming into the state from a hotspot for the coronavirus. You must quarantine for 2 weeks or face criminal action. That could mean up to 30 days in jail. Also, DHEC just confirming 539 cases across the state, and the death toll has risen to 13, one of those deaths now being in Greenville County. Greenville County also leading the state now, or at least the upstate, with cases at 51. So again, the big news out of the South Carolina Governor's News Conference, there will be no statewide stay-at-home order as of right now. He said that's still on the books, though. It could happen down